So Rett syndrome is a disorder that primarily affects girls, and the pattern of the disease is such that they have a normal birth and delivery, and then apparently normal development in the first couple months of life, although we recognize how there may be subtle changes, but typically it doesn't raise concerns for the families or the caregivers. But then around 6 to 18 months, they might start not meeting milestones quite as quickly as they should. And people might start getting concerned, but oftentimes this developmental delay is not significant enough to really cause the pediatricians or other things to refer to other specialists. At about 18 to 30 months, they actually undergo a regression, and they specifically lose some acquired hand skills and acquired spoken language, and they have difficulty walking or have an inability to walk. This regression is not relentless. It has a finite period of time where they lose skills and then they stabilize. Typically, they don't really gain much skills, or they may have a little bit of gain, but then this is lifelong. They've lost those skills and they really don't regain them. And then they develop a number of other neurological problems, such as other movement abnormalities, seizures, difficulty chewing and swallowing, difficulty with the GI system, with severe constipation, abnormal breathing, and sometimes abnormal heart rhythm. And then this is lifelong, and they really require full care for our activities of daily living throughout their entire life. The way that people who have Rett syndrome are typically managed by clinicians and oftentimes by child neurologists or geneticists or maybe developmental pediatricians is really symptomatically based. I mean, we don't have any direct targeted treatments that are specific for Rett syndrome. So, we treat the symptoms, like let's say they're trouble walking or some of their hand function. We try to provide them with therapies like physical or occupational therapy, or to communicate, we use alternative forms of communication such as eye gaze systems. When they have seizures, we give them seizure medicines just like we would give seizure medicines to anybody else. And then things like the GI system, we try to, work on how they chew and swallow. Sometimes they need to have a G tube or change what kind of food they're eating, and then work on their constipation with just constipation medicines. So currently, we provide these treatments, and some of them work okay, but none of them change the course of the disease. They just really sort of target those symptoms.